Myself is Dr. Pradeep Kumar Goswami. I am a consultant gynecologist and obstetrician and a subspecialist in fetal and maternal medicine. I am the founder and director of Fitomat Foundation and the lead consultant in this team. IVF pregnancy, or colloquially what is called as test tube babies. So basically the IVF pregnancy usually are very high premium pregnancy. It is associated with lots of emotion because the parents have struggled to conceive and they have conceived through lots of effort, financial involvement and emotions, So therefore, the assessment of pregnancy is usually more intense from the parents' point of view. However, if you look from the scientific point of view, the IVF children or IVF pregnancy are at risk of developing more complications. Something like the chances of baby getting an abnormality is more than the normal pregnancy, in particular relation to the cardiac defects. The chances that the mother's blood pressure may go up during the pregnancy is more. Many of the IVF pregnancies are elderly mothers, that means their age is more than 35. So therefore, they are more prone to develop complications like miscarriage, blood pressure problems in pregnancy, diabetes in pregnancy, things like that. Then many of the IVF pregnancies will have twin pregnancies or higher order of pregnancies. So therefore, IVF pregnancy and fetal medicine runs side by side. So advice will be, as soon as the women conceives through IVF, it is very important to confirm that number one, that the pregnancy is inside the uterus. That can be done as early as 6-7 weeks of pregnancy. Then number two, how many pregnancies are there? 1, 2 or more than 2, we call as triplet pregnancy. And the third thing is whether the dates are tallying to the date of embryo transfer. If it is a higher order of pregnancy like more than 2 pregnancies or triplet pregnancy, usually an advice is given of what we call as selective fetal reduction depending on the parent's choice. Usually triplet or higher order pregnancies are reduced to twin pregnancy, usually not less than that. Then in the first trimester, the 12 weeks, the babies are assessed for genetic screening, the Down syndrome screening through combined first trimester test. If necessary, they may need invasive testing like amniocentesis or CVS between 3 to 4 months of the pregnancy. Then a good anatomy or anomaly scan between 18 to 20 weeks of the pregnancy for details assessment of the baby. And then very important is a strong recommendation that all IVF pregnancies should have a fetal echocardiography at around 24 weeks by specially trained pediatric cardiology team. And then basically a serial assessment of the baby's growth is important. Usually in normal pregnancy, one assessment is indicated or suggested at around 32 weeks of pregnancy. For the IVF pregnancies, chances of the baby getting smaller or baby growing smaller, particularly if it is a twin pregnancy, is much more. So therefore, serial assessment or serial fetal well-being assessment is needed from 28 weeks onwards, something like 28, 32 and 34, 36 weeks of pregnancy, at least 2 to 3 scans to check for the baby's growth. There is another thing called as, in particular relation twin pregnancies, with syndrome called as twin to twin transfusion syndrome, where one baby's blood goes to the another baby and therefore one baby do not grow and the other baby overgrows. These things also can be picked up as early as 4 months of pregnancy through serial ultrasound. So IVF pregnancy and fetal medicine run side by side, and fetal medicine plays a very important role of a successful outcome of an IVF pregnancy.